Well, to talk to us a little bit more about Kenya's COVID-19 vaccine progress is Dr. Davji Bhimji Atellah, who's the National Secretary General for the Kenya Medical Practitioners, Pharmacists and Dentists Union. Thanks very much indeed for joining us, and welcome to the program.
Thank you so much.
You must be very, very concerned that frontline workers in particular are struggling to get a second dose of the vaccine.
Yes, we actually are very worried over the recent shortage of the vaccine. I think, as has been reported earlier, for the last 4 weeks, all the doctors and healthcare workers have been going to the facilities to look for the vaccine, which has been prompted by communication, the messages that they are receiving on the phones. But when they go to the centers or the places where they should be vaccinated, the vaccines have been out of stock. So this has been like that for the last 4 weeks, until yesterday when we got the donations that has been mentioned from Denmark. And that's why we were pushing and asking the government need to budget and buy the vaccine instead of only relying on the donations.
Has the government not been communicating with the healthcare professionals? Because for you to keep showing up at these centres and only to be told there that there are no vaccines doesn't seem to make much sense.
I think it's based on the communication that was coming from the ministry. It was indicating that after 8 weeks, doctors and health workers will be receiving the second dose. But when they did not receive them, they did not change that in their system. So there was a communication cut between the healthcare workers and even the Kenyans and the ministry. But then also there's been a great shortage of that vaccine. So even if there was a change, the vaccines will not be available at the time.
So 900,000 got the first dose. You've only got 358,000 that's been donated. So even if you use this donation, there's still a shortfall.
Yes, there's still a big shortfall for the vaccine. And that's why we were asking the government and that they should not just rely on the donation, because it's possible if they can budget for other things, they need to budget to buy this vaccine so that they can objectively know that they'll have the vaccine and manage to vaccinate the population, both the healthcare workers and the Kenyans.
How is Kenya in this situation? You are one of the most developed countries on the continent, a powerhouse in East Africa. How is it that you are in this position?
I think generally it's something that happens in African countries, is over-relying on donation and believing that these particular vaccines will come from the COVAX and really probably from India. But if we took the priority to budget, because that's what we were pushing in this particular 2021-2022 budget, that if we can put a percentage of our annual budget into purchasing the vaccine and giving it a priority, then I think we won't be at the same scenario that we are in. But just like other African countries, we will put priority to development and to economy and other things rather than vaccinating the people who actually will make the economy to reopen. And that's why we, together with all the civil societies and all the other organizations and the unions, we are pushing that there should be a budget and money to purchase the vaccine. Let's close other things and make the vaccines available.
What is the danger of not getting the vaccine, the second one, jab, in time, or not getting it at all?
The first dose, the first jab of vaccine, which I think we got, it's about 1 million Kenyans. That's about 1% of the population. It means then that after the 8 weeks or 12 weeks, if you don't get the second jab, then the immunity that you develop by getting the booster vaccines waves on or wins out. So you will be actually like somebody who has not been vaccinated over time. And that's why we are encouraging that people should get the second dose of the vaccine once it's made available. Because if you get one dose and then you don't get the booster dose, the chances of actually getting the protection reduces. So the danger is you can get infected, you can get infection, which then will be severe.
Your healthcare workers must be extremely frightened then.
They're actually frightened, and it's just like every other place. The infection is high. Look, in Western Kenya, we have seen a big surge in the coronavirus, whereby the positivity rate has gone to over 10%. So there's actually more fear if you go to the parts of Kisumu, the parts of Webuye, the parts of Nyanza, which has got a bigger, long hours of curfew, which goes between 7 p.m. to 6 a.m.
And my fear on the continent with using testing numbers is that it really doesn't paint a picture. What's more reliable often is the number of people that show up at hospitals. Have you seen a spike there?
Yes, there's a big spike in the sense that most of the hospitals are fully occupied currently with patients. And this surge occurred over a month ago. And currently, we will say that the facilities that are available are fully utilized.
Well, so you don't have capacity anymore to get any more patients?
In the western region, western part of Kenya.
And I would imagine that means that your members are overworked because you probably don't have enough medical staff to deal with this current wave.
Quite true, quite affirmative. They're overworked, and that's why we hope that as we push for the more vaccines, we are also pushing for the government to employ more staff and to employ more healthcare workers.
I had a conversation with a Kenyan doctor not so long ago, and there were issues about things like payment, protective equipment. Are these still things that you're grappling with, even though you're in the midst of this pandemic?
Yes, we're actually still pushing for the same. The PPEs to be available, even the remuneration, because the number of doctors who are employed purely to help in the COVID and on the universal health coverage, who are paid a different package from those who are earlier employed by the government. So those are the ones that, as much as they are in the employment, their terms are lower. We're pushing for them to get better terms. At the same time, we are pushing for the availability of PPEs, because there's the ultimate way, if there are no vaccines, there's need to at least have the protective gear for the healthcare workers and the doctors.
All right. I mean, it sounds like you're in the middle of a crisis in terms of just the healthcare workers. Are we saying that the general population hasn't even begun to be vaccinated at this stage?
No, not at all. They have not begun, because when you look at the Kenyan population, is a population of about 40 to 50 million Kenyans. And the first dose that came was 950,000. That is around 0.8 to 0.7% of the Kenyans were vaccinated on the first dose. And then the second dose that came was 120,000 doses, then 350,000 that came yesterday. So generally, it means that a bigger population of both the older and the vulnerable population, and even the general population have not been vaccinated.
I mean,
so the coverage that has been done is mostly on the healthcare workers and a few of the older population. And the distribution also has not been uniform, because there are places that the vaccine has not been transported to.
I mean, you're painting a pretty dire picture. At the beginning of this conversation, in the introduction to this interview, I talked about Kenya having an ambition of vaccinating just 30% of the population by 2023. I mean, you potentially have, I don't know, if we say 3 waves a year, you have probably another 6 or 7 waves to look forward to.
We're actually saying you're on the 4th wave currently, because I think March, April, you're on the 3rd wave. So the picture is not good, in the sense that the only way, and I believe the best way to combat the virus, is by having the vaccine, in which I would say at the moment we are doing about 1% or less. So if the plan is to do 30%, then we need to be more aggressive than we are currently. And that is why we are saying there is need, together with Amnesty and other organizations, that there's need not to depend only on donations, but there's need to budget and push the government to prioritize buying the vaccines for Kenyans and all the healthcare workers. But as long as you depend on donations, and as long as you depend on short expiry donations, then it means the timing will not be as near as it's said.
But an ambition of just 30% by 2023 doesn't sound like it's hardly enough. When we look at Europe, look at America, they're already at 70, 80% in the first year. And this is where we need to be getting to be starting to talk about herd immunity and some level of safety. 30% by 2023 just isn't enough, Dr. Atellah.
Not at all, not enough. Because for us to prevent even the remodeling that you were checking on reinfection and waves, it talks about that can only come in situations whereby we have about 50 to 60% vaccination. But then when we are talking about 30% in 2023, it's, I think, long period, in case that has not even been achieved in the last 6 months. Because if we just project 1% in the last 4 months, meaning if we get another 3 million, that will be about less than 5%. So in the next year and the other year, if the government fails to budget for this, then we cannot talk about 30 or more than 10% in the coming years.
I get a sense.
That's why we.
I get a sense
Yes,
that you're saying that the authorities have been found wanting, that they haven't planned properly, and these are the consequences of poor forward-looking in terms of dealing with the crisis. Are you hopeful that this will change? Because if it doesn't, the story that we'll be having, the conversation we'll be having in 6 months' time might be very, very dire.
We are always hopeful because, I mean, most of the time government acts with pressure, and we see many different bodies in the society, including our union, the Doctors' Union, the Amnesty, and all other organizations in the country have decided to push the country. And even the parliament, in the allocation that was just on paper and not really in the budget, to push for this particular buying of the vaccines. Because then if they are well pushed and they're ready to do it, then we may have a change. But if that doesn't happen, then even the economy will not be open, because then the spread of the virus will still continue. So then we have to look at it. It may look like a lot of money in the budget, but at the end of the day, it will combat the vaccine and to combat the severe conditions and to combat the death that's come out of it.
Dr. Atellah, we're going to leave it there, but we wish you the very best of luck, and the people of Kenya, that things happen and happen quickly. Thanks so much indeed for your time.
Thank you.
All right, that's the National General Secretary for the Kenya Medical Practitioners, Pharmacists and Dentists Union, Dr. Davji Bhimji Atellah, painting a pretty grim picture about the vaccination rollout in Kenya.